everybody. Welcome inside the sit down. Ryan Mayer here alongside Dr. Jonathan Gelber. He's got a new book coming out that you're going to want to check out. It's all about some of the sports injuries and tragedies and how they've impacted society. So first, Doc, thanks for coming in today.
Thanks,
Appreciate
Ryan.
it.
Thanks for having me.
So you've got this book coming out in October, and I'm just curious first, what made you delve into this topic? Sports injuries obviously are something we hear more and more about every day, but their connection to larger societal problems isn't necessarily something we think about all the time because we're just thinking about either fantasy lineups or whatever the case is.
Right. So as an orthopedic surgeon and sports medicine specialist, I'm surrounded by athletes and injuries all the time. And one of the biggest issues I've seen for a long time that I wanted to talk about was the Tommy John surgery epidemic. So that was sort of the first topic that came to mind when I wanted to write a book. But to delve just into that specific niche of baseball and protecting our kids and our pastime was a bit of a niche audience.
Right.
So I decided to sort of expand that to, well, let's see what other major injuries are out there that we don't know all the stories about. But even then, it sort of was done before. And I'm a big fan of Malcolm Gladwell and that popular science genre. And one of the things Malcolm Gladwell had said in a lecture I had watched was he really likes to take a topic and sort of spin it around. So the thing he was talking about was David and Goliath.
Right.
And so we all kind of know that story, but his take on it, well, what if Goliath couldn't see? Maybe David wasn't so accurate. Maybe it was, that Goliath couldn't see well. And so you sort of take that topic and you spin it around to give like a new perspective.
And look at it from a new perspective, yeah.
Exactly, and so that's why I started to take some of these injuries that we've known throughout sports history and sort of see, okay, well, we know the story, but do we know all of the story? And what if we take a different perspective? Can we see how it's affected things? And the more you research it, the more you see that it's not just about the athlete's career, but it's also about the sport itself. And as I show in the book, it's actually society in general that can be affected by these injuries.
And you mentioned Malcolm Gladwell, and of course his famous theory is the 10,000 hours theory. You practice for 10,000 hours in order to try and become an expert in a certain field. That's exactly what he was going into with that popular science. For you, it's the Cobra Effect. And that's not, again, like the 10,000 hours theory prior to Malcolm Gladwell, probably not something people have heard about before. So just from your perspective, kind of bring the people into what the Cobra Effect is and how it relates here to things like Tommy John surgery and the epidemic that we're seeing right now in young kids.
Sure. So the story actually with the book opens up with this Cobra Effect. And I wanted to title the book The Cobra Effect, but my apologies to Julie, my editor, but they weren't having that. And most people don't know what it is. So we had to sort of put it in the book but not call the book The Cobra Effect. And the Cobra Effect story basically takes place in Imperial India. And at the time, there's a explosion of snakes, mostly cobras. And it's to the point that they want to get it under control, and they have to figure out how. So one of the things they do is they employ the village folk to basically hunt the cobras.
Sure.
And they put a bounty on the cobra. Basically, for every skin that you brought the Shah or the governor, you would get a certain bounty. So the people went out and they started to kill the snakes. They would skin the snakes. They were coming in by the basketful. And the baskets and bounties were piling up, but the snake population didn't change. So that sort of sparked an interest. Okay, well, what was happening here? So after the government officials started to delve deeper into it, they realized that the village folks weren't necessarily going out into the wild to kill the cobras, but actually were farming them themselves.
Right.
So they're raising cobras, killing them, taking their skins, and bringing them to the Shah for the reward. So once sort of this reached the government, they decided, okay, we're shutting this program down. So all these folks who had these snake farms had nothing left to do with these snakes, so they released the cobras back into the wild. In doing that, they increased the cobra population even further.
Right.
So what was initially a program to reduce the snake population, specifically the cobras, resulted in unintended and opposite effect.
Right.
And that is
unintended
the Cobra
consequences of a decision made to try and address an original problem.
Exactly.
And that's exactly where you get into with the Tommy John surgery. Because obviously, at the time, Tommy John and that breakthrough from Drs. Curlin and Jobe was huge. For him to be able to come back from an injury that had derailed Sandy Koufax's career and pitch well long after he had had the surgery, it was great. And continues to bring a lot of pitchers back into the major leagues. But also, as you delve into in the book, we've seen higher and higher rates of it happening, not just at the major league level, but actually at the lower levels in the little leagues, and some misinformation that's happening among parents and coaches.
Yeah, if you look at over the last 10 years, the number of Tommy John surgeries have basically tripled, and the biggest demographic has been the 15 to 19-year-old, not the professional level, not even really college. You're talking high schoolers. And so that is really why we call it an epidemic. And surgeons like James Andrews, who are world-renowned, they say to themselves, what's going on here? Why are we dealing with such an epidemic? And if we never had that surgery, there's a question of, well, would we have that epidemic? Now, obviously, we didn't have the surgery, we wouldn't be doing it in the first place.
Right.
So obviously, the surgery did its job in getting Tommy John back, and it does a rather successful job of getting pitchers back, although it's not as successful as people think.
Right.
And what's interesting though is there's a lot of misinformation around it. So some docs have done various studies, one in 2010 and one a couple years later, and they did interviews with high school coaches, high school athletes, and even extended it to the Major League Baseball media. And in both studies, nearly half the people interviewed did not know you needed an injury.
Right, in order to have the surgery.
Tommy John surgery, exactly. And it was sort of this performance enhancement thing. Okay, it was like, if anybody thinks of the old movie Rookie of the Year, but now I'm starting to date myself.
No, I love that movie.
The kid gets hurt, they tighten up his arm, all of a sudden he's a great thrower. And that's what Tommy John surgery was to a lot of people. And that's completely false.
Right.
You need an injury to your ligament on the inner side of your elbow, and you can't pitch without this ligament. You can do other things, but you can't pitch. And so this surgery is meant to get that pitcher back. And so that's a key thing that was missed somewhere in the process of educating everybody.
Right.
And some of the other things that we found in these studies was that the lack of education extended to injury prevention itself. So there's certain things when it comes to these young athletes, these young pitchers who are getting hurt, that we need to educate people about. And some of these are, pitch counts. So there are certain numbers, and you can go to usabaseball.org or pitchsmart.org, and you can find these numbers based on how old you are, how many innings you've thrown, how many pitches you're allowed. And so if you follow these pitch counts, it'll reduce the number of potential injuries you'll have as a young athlete, as well as playing for more than one team at the same time is a risk factor, and not taking enough time off every year. And that's something that's a big issue because we have early sports specialization right now.
Yep.
And kids are trying to play the same sport year-round, and we're really not meant to play the same sport year-round, especially like a one-sided sport like baseball. You're basically using one side of your body more than the other. So you got to cross-train. You can take 3 months off of baseball, do anything. You can do another sport, just don't do baseball for those 3 months. And actually, if you look at a map, someone a couple of years ago had done a map of the 300 career winners and where they came from. And if you sort of drew the Mason-Dixon line separating the North from the South, more of them came from the North, where at that time they couldn't play year-round.
They couldn't pitch during the winter.
Right. So basically, we're trying to prevent these kids from playing year-round so that they can have a longer career. Because the downside is you have a surgery, you may not come back from it, and you may derail your career. Nobody wants a broken pitcher on their team.
Right. And the unintended consequence there, of course, is all of this misinformation and being looked at as a quote-unquote miracle type of cure or performance enhancement in that respect. So I guess from your perspective, you mentioned the education and trying to get this information in front of people, but we've had Pitch Smart for a while. We've had this information about pitch counts for a while. Jeff Passan just wrote a book a couple years ago called The Arm on this topic. How do we do a better job of getting that info in front of these parents, in front of these coaches, to make sure that we are taking care of the young arms?
Yeah, I mean, that's really hard. I mean, as a doctor, I can at least do it in the exam room. Right. Coaches hopefully can do that out on the field. The media, I mentioned in my book, even, Jeff himself had an experience after he wrote the book where he was talking to a mother, and she had no idea that her son was clearly over the pitch count. And here he is with a New York Times best-selling book, and he didn't even get to her.
Right.
So, we have to figure out better ways to get this information out there, and it's education, and people say that about a lot of things. But, really, that's the ultimate goal, is you just got to figure out, but it's mostly who's with the athlete every day. If I see them as a doctor, their arm's already hurting, so I can kind of warn them, whoa, you got to slow down. These are the risk factors. But, educating Little League coaches, high school coaches, college coaches, and parents. Hopefully something like my book, like Jeff's book, can get out there and help the media to get some of this information to the athletes and to the parents, because ultimately a lot of these are kids, and their parents are with them, and if someone's not going to stop the kid because the kid's naturally motivated.
Right.
Like he has friends, he has teammates, he wants to get out there
exactly.
and pitch.
He doesn't want to let the team down by not being able to pitch that day.
Exactly. So we as a parents or as coaches, we have to almost protect the athlete from themselves.
Right.
And I think that's what we got to do when we start to educate people.
Yeah, and I think that's one of the main kind of things that I took away from this book in multiple different areas, is getting that information out to people is so critical, and how we do so, right? Because one of the other pieces that you mentioned in the book is Magic Johnson, and his press conference announcing that he had the HIV virus and becoming the face of HIV awareness and testing, and it had some effect. The celebrity effect, as you say in the book, is real. You did see higher rates of testing for HIV in the wake of the announcement, but it may not have been the people most at risk. So finding those ways to communicate the information, and the best way to do so, I think, is kind of a crucial part of what you're getting at here in how we think about these various medical conditions and issues.
That's exactly right. With the Magic Johnson story, he often says he's both a blessing and the curse of the HIV awareness. He was a blessing in the fact that at that time it was still a relatively unknown disease. Most people were unfamiliar with it, but him returning to the NBA helped show that you can't get it through social contact, you can't get it through sweat. He also helped people understand the difference between HIV, the disease, and AIDS, the syndrome, and things like T cells. So that educated folks. And he did bring out the awareness, and as you mentioned, docs actually were able to study this Magic Johnson effect, because a lot of times they were actually just taking testing samples and recording how many people per month were submitting blood tests, and it just happened that they were recording during the time that he made his announcement, so they were able to go back and say, okay, his announcement was here, let's follow this line and say, okay, there's a spike here, and then they take that spike and they break it up into demographics.
Yep.
And so they're actually able to break it up to white or Caucasian, black or African American, and Hispanics, male and female, and of course different risk factors, heterosexual, LGBT, and self-identified homosexuals. And what they see is that the greatest and longest lasting effect was white, basically under 40 heterosexual males. The big sort of NBA fan, and that was great that they had that spike and it stayed longer than other demographics, but from a sort of epidemiologic point of view, they're the least at risk to have HIV. So we're testing more people, but the odds of us finding those people with HIV was actually less in that population. The greatest group at risk, and still today, despite the trend downward, is young African American females. And if you look at the announcement, you do see there is a spike, and in fact, one of the biggest spikes is in females and also in African Americans, but it quickly dwindles. There was no long-term
tailors off
effect.
very fast.
Exactly, and so like you said, the effect is real, and we've seen that with Charlie Sheen. We've seen that with Angelina Jolie and her BRCA and breast cancer awareness. So people will respond to celebrities, but the key is to get that to last longer than just a few weeks.
Right.
And with Magic Johnson, the African American female, actually, if you look next to him during his announcement, his wife is there. And if anyone follows the story, of course you can read about it in the book, there was a time period where Magic and his wife didn't know if she was infected with the HIV, and they had a child on the way. So big dramatic issue here, and that was something. Cookie by nature was less outgoing than Magic. She sort of preferred to stay out of the spotlight. Since then she's actually worked with Oprah and some other people in coming out and helping with awareness. But she was actually maybe the better face for that campaign. Magic with his celebrity was great, but he wasn't necessarily reaching the people that were at most need for that message. In this case, it was the African American female.
And overall in the book, obviously we were talking about the crucial factor that information and how we disseminate that plays in this effect, right? And how people think about these various things. And one of the other cases that you bring up in the book is steroid use within the NFL. Lyle Alzado, a former Los Angeles Raiders defensive lineman and Denver Broncos defensive lineman, part of the Orange Crush teams. He was and came out later after his career in a Sports Illustrated article, a steroid user and a steroid abuser in that category, ends up dying young. But there are still athletes today that use steroids. There are still bodybuilders today that use steroids. And it seems like some of the effects, as you mentioned in the book, aren't necessarily known the way they should be. Everybody talks about roid rage and how that up level of testosterone can bring out more aggression in someone, but that's actually rarer than some of the bigger issues that we see with steroids.
Mm-hmm. Yeah, that's absolutely correct. You know, the Lyle Zeta issue, you know, it almost drove the conversation underground, because he came out, and rightfully so, that there are dangers to steroids. Now, he had, you know, a lymphoma, which may or may not have come from the steroids, but he tried to pin it on the steroids.
Right.
And the bodybuilding community was looking around at the time saying, you know, we know it works. None of us are getting sick.
Right.
So, you know,
so it can't be.
Exactly. We're just going to discredit him, and the media that jumped on that bandwagon, we're going to discredit the whole thing. We're just going to go do our thing because we know steroids work. There are, like you said, documented risks of steroids.
Mm-hmm.
You know, roid rage is one of them, but it's much more rare. And that's another thing with the bodybuilding community. Not everyone is having roid rage, so they're going to say, okay, well, you're telling me I have to worry about roid rage. I'm fine. I'm going to go back to doing my thing. But there are things like cardiovascular disease. All right, that's actually well documented,
mm-hmm.
and that's a real, much more common side effect. Depression is another one, and so those are both treatable things, and those are maybe the risk factors or of steroid use that we need to be focusing on.
Right.
And especially with the cardiovascular disease, you have a lot of guys who started using in the 80s. And they were younger, you know, they're in their 20s. Now they're coming into their 50s and their 60s, and they're starting to see the cardiovascular disease effects of anabolic steroids. So what happened was the media and Lyle Zeta, by trying to pinpoint everything on these things like roid rage
Sure.
and, you know, his lymphoma on steroids, they sort of lost credibility, especially with the bodybuilding and perhaps the athletic community. So while the concept was good in that we wanted to get a face on a problem like we did with Magic Johnson,
mm-hmm.
you know, maybe like Magic, Lyle was the wrong face for that campaign.
Now, and overall for you, as you were going through this, you talked about some of the various sports events that immediately came to mind that you wanted to hit on, but what was maybe the most surprising one for you that had a far-reaching impact on society? Because obviously you cover various different injuries, tragedies, it's all covered within the book. What was the one that stood out most and surprised you, really?
Yeah, the one that stood out the most to me as having the greatest effect was actually Len Bias.
Mm.
And for those, you know, of the viewers who don't know who Len Bias was, Mike Krzyzewski actually thought he was the next Michael Jordan.
Yeah.
He was a college standout. He was the #1 NBA draft pick for the Boston Celtics.
Yep.
He was drafted. A few days later, he dies of a drug overdose. And at the time, it was the war on drugs. It was the 1980s. Ronald Reagan was president. It was an election year, so there was a lot of politics involved. And so what happened was this Len Bias overdose really became a focal point for the war on drugs.
Mm-hmm.
And so Congress passed several laws, and they're referred to as the Len Bias laws, some of which focused drug dealers. So one of them is if you are a dealer, you distribute drugs, and someone dies from an overdose, that drug dealer, or that person who gave him the drugs, can be charged. And that was because his friend, Brian Tribble, is the one that we thought gave him the drugs. That was directed basically at Brian Tribble. What the media at the time was really focusing on was crack.
Right.
The crack epidemic. And you know, at the time, we thought crack was much worse than cocaine. Now we see that actually those effects may have been exaggerated, and cocaine and crack are both, you know,
they're both bad for you,
exactly,
but basically equaling amounts of terrible for you.
Right. And so what happened was they basically said, okay, well, we have an African American who died of a drug overdose. He died of cocaine, not crack, but we're going to go ahead and say it was crack, and we're going to use this, you know, lightning rod to basically put all these drug laws to help punish these offenders and make mandatory sentences. And what they did is they weighed them heavily towards crack. Even though Len Bias didn't use crack, he used cocaine, they're going to weigh him towards crack. And so what ended up happening was, you know, most of the African American community was the
right.
one who had crack in possession. The, you know, Caucasian or white community had cocaine, and so even already then, you know, we had sort of a disparity in the criminal justice system.
Right.
So now you're basically taking the African American community who has more crack problems that are being prosecuted, and we're going to basically make harsher sentences for them. So it made this system that was already disparate even further disparate.
Right.
And the reason it even became, less than intended was the idea was to sort of get the high-level drug dealer, And so what they did is they had some issues in Congress, and different states fought for different amounts to sort of trigger these laws. But basically it became about 5 grams of powder cocaine or 500 grams of crack cocaine. So if someone had, sorry, the other way around.
Yeah.
So if you had 5.1 grams of crack, you would be prosecuted. If you had 490 grams of cocaine, you wouldn't meet that threshold.
Right.
But most of the big-time drug dealers would have the higher gram of cocaine,
sure,
but not the higher gram of the crack. The ones who had crack were the lower level drug dealers, and they're the ones more likely to be caught and prosecuted. So that really set in motion events that we're still dealing with today. We sort of straightened it out a little bit more under President Obama. He had a Fair Sentencing Act, and so that sort of shifted that ratio of crack to cocaine a little more fairly. But even under the current administration, they have this new program, the First Step program, where they're allowing that Fair Drug Sentencing Act to be enacted retroactively as part of our criminal justice system reform that our government's attempting to do. So here we're still passing laws, we're still talking about criminal justice reform, and they be traced to drug sentencing laws, which can be traced almost directly back to Len Bias,
which is kind of an amazing exploration, and it was the one that surprised me the most as well, because we've talked a lot in recent years in this country about the need for criminal justice reform, the changing of mandatory minimum sentencing, and I thought I knew a lot about that topic and had read up enough, and then didn't even come to realize that actually originally it was the Len Bias laws that were the underpinnings here of further down the line where we are now. So it really is interesting how that effect kind of plays with each other. So one of the other things that I'm interested in is, from your standpoint, the Cobra Effect obviously is something that we may not have the foresight as humans to be able to see all the unintended consequences of something we're trying to fix. With Tommy John, we didn't see 15-year-old kids later down the line thinking, oh yeah, no, I can just have the surgery with no problem. How do we try and avoid this? What are the steps that we try and take to make sure that we're thinking of these problems in a way that maybe doesn't have those intended consequences down the line? Or is it human nature to do so?
Yeah, I mean, it is certainly a challenge, and one of the things I try to do in the book is each chapter opens up with a non-sports analogy. So one of them is the Smokey Bear analogy. There's actually a Smokey Bear effect where we tried to prevent forest fires by following basically the German way of doing things, which was we got to stop all fires. We got to put them out by 10 a.m. the next morning, because if we don't, we're losing our timber supply, and we need to sell our timber. So we're going to focus on putting out forest fires right away. And so what ended up happening was the number of fire-resistant trees increased. The area of trees in general in forests increased. And so what happened was the risk of severe fire outbreaks actually went up. And so this idea that we're going to be very rigid in what we're going to do, because I have the answer and this is what we're going to do, and finding out much later it actually made the problem worse, is human nature, but it is something that hopefully we can at least be aware of. Because like you said, we can't always predict the future. But if we can understand that there are certain emotional reactions to things. So a lot of these injuries and tragedies are emotional reactions, like the Len Bias laws. A lot of it is politics that plays into the role of things, and a lot of it is just not analyzing the information correctly. So for instance, with Magic Johnson, we said, okay, great, testing rates are going up. We did our job, but actually wasn't the testing rates of the population that we wanted. Exactly. So it's maybe using the wrong marker sometimes, for progress is another thing. And I try to do that and show that the Cobra Effect's not a singular thing. There's certain
nuances. It's a combination of various factors, but at the very least, if we're being more thoughtful and trying to take our own biases out of those decisions and factors, as you mentioned, from the political side of things, from the emotional reaction, maybe we can get a little bit closer to that ultimate goal of not having those unintended consequences further down the line.
Yes, that's very well said.
So finally, just as you look at this book, and we're getting closer and closer to the release date now, just what do you hope the effect is that people have, or the thoughts that people have coming out of reading it?
Well, you know, one of the things is I did want to introduce the idea of the Cobra Effect, and so, you know, hopefully that will introduce it to more popular terminology. But, you know, realize that, you know, our reactions, you know, are not necessarily always the right ones. And, you know, like you mentioned, that we just have to sometimes take a step back, you know, and use these, you know, sports injuries and tragedies as an example. Right. And I think it just may be a way of thinking that I think hopefully people will take from this book. And of course, obviously, the stories are all cool. Even the non-sports ones are really cool.
Right.
And so, you know, you have something to talk about with your friends.
Absolutely.
So hopefully, you know, besides just reintroducing these characters back into society, we learn something about what has transpired.
Well, Doc, it's been a pleasure.
Thanks
for coming in today. I know it's a busy time for you right now, getting ready for a move. You got the book coming out, everything going on. We appreciate you coming in and sitting down with us today. Again, you can check out Dr. Gelber's book coming out in October. It'll be available where all books are sold. We'll see you next time here on The Sit Down.